Today. I can't tell you how exciting it is to see this many social workers and folks from Human Services in these chambers right now. It is very special, and I encourage you all to continue coming back, advocating for the work that we're doing as often as you would like. You're always welcome. I want to thank you for taking the time away from your busy schedules to be here today, to have a really needed and very long overdue discussion about the future of our human service sector. I also would like to thank my colleague, Councilmember Nancy Day-Acauer, for making time to be with us today. Probably like many of you also, her and I have worked together for many years before we were on council addressing human service needs in our community, and so it means a lot to me that you are joining for the discussion today. The goal of this hearing is to hear from you, from our stakeholders, from organizations that are large, from organizations that are small. We know that our human service sector is struggling, and we know that the patient and compassionate and kind people that are doing this work are struggling too. And we're hoping today to have a transparent dialogue about funding challenges and workforce issues and opportunities for the future so that we can address those issues, not just to support our workforce, but at the end of the day, we're here to try to support our community. And so in order to do that, as Columbus continues to grow, we know we're going to need to make some changes. As my colleague, Councilmember Dorans, often says, only in the context of our housing shortages. When it comes to our human service sector, the problems that we're trying to solve for are no more complicated than a supply and a demand issue. We know the demand for support has increased significantly following COVID. In some areas, subsectors of the sector has more than tripled, and investments have remained stagnant. And so in order to address those needs holistically, we have to have an honest conversation about it. And I'm just curious, how many of you in this room right now, if you could raise your hand, have had a challenge addressing the demand for services because of this supply and demand issue? Pretty much everyone. Well, yeah. Do I have 4 hands? So we see that. We know that that's the reality. We know that we need to make adjustments to address it, and it starts by having an honest conversation. It also starts, the city of Columbus, we know we can't do this alone. We know we have to stack hands with our partners across the county, with our other funding agencies, to figure out how we can work together to both increase investment as well as increase efficiency and stretch those dollars even further. The work that's being done here is absolutely critical and life-saving work. And the way that I often try to think about it, in government, we talk all the time about our housing infrastructure. We talk all the time about the need for our transit infrastructure. I think that this is a very critical investment that we need to be making in our human infrastructure. And it's an investment that has very significant long-term savings down the road. If you look at a national level, in the hundreds of billions of dollars a year. For every $1 we invest in behavioral health care, for example, we see a $4 to $5 return on that investment. And so hopeful here today we can have an honest conversations about the issues that we're experiencing across the sector and use this as an opportunity for a jumping off point. So this is not the only conversation we're going to have. It's the first of what I hope to be many collaborations with all of you here today so that we can figure out how to proactively and strategically support the people in our community that need support. Nancy, did you want to make any comments? Okay. So what we are going to do right now is hear a few words from our Deputy Director of Development, Hannah Jones, and then we're going to receive a presentation from our Human Service Chamber Executive Director, Michael Corey, who has been collecting some data and information around the workforce and funding issues that we're currently seeing across the sector. And then we will open it up to our invited guests and our public speakers today so that we can more thoroughly unpack the challenges that we have ahead of us. So, Deputy Director, I'll turn it over to you.
Thank you, Chair Green, Councilmember Day-Acauer. Thank you for the opportunity to speak today. The City of Columbus believes that investing local and federal resources in the human services sector has been and continues to be a key component to a growing and thriving community. Yes, ma'am. Departments throughout the administration rely on our community partners to provide services and activities that meet critical needs and enhance the quality of life for our residents. In addition to the programmatic support for department priorities related to housing, the Department of Development is focused on providing flexible general operating support. Through our competitive grant process, we offer $10 million annually to approximately 112 grantees, providing general operations grants to assist these agencies in building their capacity. We recognize that these organizations play a critical role in our neighborhoods, not only as service providers, but as employers. Nonprofits are not unlike small to medium-sized businesses, which must balance their production with their back office support. A small business cannot survive without quality human resources management, accounting, marketing, and a host of other functions, and a not-for-profit is no different. We are working with the Franklin County Human Services Chamber to implement a shared services model for our grantees as well as chamber members. A shared services model allows nonprofits access necessary services that are focused on reducing costs per agency, growing their organizational management capacity, and creating efficiencies to save resources and focus on community needs. I appreciate the opportunity to highlight and share this work with you. I want to recognize Kim Stans and Sam Masters, who are here, who manage these programs and work closely with all of the partners in this room to share and uplift their work and stories. I look forward to Mr. Corey's presentation as well as the other speakers, and I'm happy to answer any questions you or the council member may have at this time.
No questions from me at this point in time, but I do just want to acknowledge and recognize, the shift to the model with the Elevate program. It seems so common sense. I think the solutions to a lot of really big problems are common sense solutions, right? But turning this ship of government and adjusting the way that we're thinking about how we're funding things is not always easy to do. And so I just really want to thank you for the work that you have done to adjust the model and the attention that you have poured into trying to problem solve for some of these efficiency problems and restrictions in funding issues, and for the example that you've set, hopefully, for other partners across our community for how we could all start thinking about how we fund programs at the local level a little bit differently. Yeah. And so then at this time, I would like to turn the floor over to Michael Corey to come and say a few words. If you would like to come to the podium, you can, or you can, yep. Now, correct me if I'm wrong, this data is hot off the presses, right? So everyone here is getting a preview of information that we haven't shared yet.
Thank you. I'm clearly an old millennial because I have to bring my laptop with me as opposed to notes. Forgive me for that. Thank you, first Councilmember and Councilmember for hosting us today and having this candid conversation. And that's a beautiful sight. I'm so grateful to all of our bosses that have taken the time to be here today in solidarity, but also to share some of their insights. I'm going to try to speak as briefly as possible because I don't know anything. We're just trying to repackage and share and amplify what they've been telling us for the last 4 years and certainly the last 8 months, as this year's turned. I'm really grateful for the chance to have this ongoing conversation, but add some urgency to where we're at and where we think we're headed. I wanted to start, and forgive all the words that you can't see, by showing a picture from the day the Human Service Chamber started. This was back in 2010 when some of the folks behind me started this organization. There were 70 nonprofits that had banded together at the time to try and represent one voice. And I think they would be proud of where we're at today to try to represent one voice, but many varied voices to talk about the needs of this community and how much it has changed in the time since then and how much we need to do differently now that we're at 2024 heading into a lot of uncertainty, but with hope too. We conducted this survey in June and July of this year. It's the fourth of these surveys that we've conducted. We had 93 responses despite 1,000,001 emails pleading for more responses, but we know how busy everyone is, and I'm grateful for the responses we did get. The agencies that responded are as diverse in their size, as in the work that they do, as in the neighborhoods they serve, but as you'll see, there are a lot of common challenges, no matter the organization or the work that they do. So let's jump into those. The demand for services. If you go away with this, with nothing else, I want you to think about the demand for services. It has gone up and up and up since March of 2020. That little sliver of blue represents a single agency saying last year that demand had actually gone down for them. For everyone else, it's either remained the same or gone up every time we've asked this question. In just this year alone, even as the economic situation has improved, even as inflation has eased, the demand has gone up at 63% of our agencies and has stayed the same at 36%. That's an extraordinary figure. And a lot of our organizations can navigate surges of need. They can move resources around, they can make temporary hires, they can get a one-time grant here or there, but the sustained amount of increased need is having a significant effect. And you're going to hear about that a lot today. We also asked about their ability to meet that demand. And I'm disappointed to tell you this is actually a little better than it was the last time we asked this question, but 62% of respondents can't meet the current demand. That's a lot of people that aren't getting the help that our agencies know how to deliver, but they don't have the resources to deliver that care. And then, just as concerning, half of our respondents don't anticipate being able to meet the demand next year, with another 60% saying it depends. Are we going to get this grant? Are we going to hold on to these employees that might leave? Things like that. This, to me, is something we can and must do better at. We have to be able to meet the demands that exist in this community to help people. We asked about financials. Do you anticipate a deficit at the end of this year, fiscal or calendar year? And 63% of respondents are anticipating that. And I know this was a tricky question for some folks to answer because they can make moves to avoid that. And we'll talk about what they'll do to avoid that. But that's not an indicator of a lack of business savvy from the sector's leaders. That is an indicator of a lack of resources to do what they need to do to help folks. What explains that deficit? It's the same things you would imagine. It's the same things plaguing other sectors. They're just uniquely challenging in ours. The biggest one is higher costs. That has become a bigger and bigger element of the revenue and financial situation for our sector, whether really big agencies or really small agencies. The other big pieces there are decreased grant revenue, other decreased revenue, and of course that higher demand piece. All of that being intertwined, of course. So what are agencies having to do with those potential shortfalls? The primary thing they're planning to do is cut other costs. They have to make workforce adjustments, and they're going to have to do program cutbacks. Fortunately, just a few are currently planning program eliminations, but I'll tell you today, there are two well-known agencies that have already closed their doors in this community. That is more than our communities had to close since the pandemic started. We were running at 100%, and this year we've had two close, and I anticipate similar challenges going forward unless we act. We wanted to just get a sense of the savings that existed as well. You can see those figures there. Those are numbers that are pretty consistent from the last couple of times we've asked it, but we shouldn't have to be in a situation where they're going to have to look into those emergency funds just to keep meeting community needs. And then the last key data point I wanted to share here was on workforce. And again, all of this is intertwined. We've been asking every year, has it gotten easier, harder, or remained the same in recruiting and retaining talent? And unfortunately, these are the best figures we've seen in 4 years, and these aren't encouraging figures. 30% of agencies are having a harder time compared to 1 year ago in recruiting and retaining talent, despite all the improvements that we're all privy to. 57% say it's about the same, which means really freaking hard. And 13%, fortunately, are saying it's a little bit easier. So that's where some improvement has come. And why? Why is it so hard to do this in the nonprofit sector? And of course, these are challenges that are universal across the United States in our sector, outside of the hospitals, which don't count. It's wages and benefits. It's finding qualified staff. it's workload, it's burnout. The burnout piece has actually improved the most since the first time we asked this question, but the other challenges have either remained just as significant or have gotten more so. Before I get into some good stuff, I want to talk about how this is all kind of weaved together and why this is so urgent now, because as we've noted, these are not new challenges. These are not new conversations per se, but the fact that they are so sustained and the fact that we're going into a very uncertain year of 2025 makes it urgent for us to act, and we can choose to act. We can choose to avoid the sector from being as strained as it has been. We can choose to avoid not being able to meet the needs of this community. And this doesn't fall just on the city of Columbus, of course. It's on the county, it's on the business community, it's on the philanthropic community, it's on us to tell this story and identify the figures as best we can. But we have to act together. And we have wanted to act for the last several years. We want your development team, which is wonderful and incredibly supportive, to have many, many, many more resources to be able to dole out to the sector and through the sector to help folks. But all these challenges are intertwined because without the dollars, you can't maintain the staffing you need to meet the demand, which keeps getting higher. And we're hearing all sorts of interesting things that our members are trying to do to navigate this. They're looking at the real estate in a different way. So many of our folks are talking about co-locating. What properties do we own that we can sell? Where do we save dollars there? How do we make ourselves a more diverse kind of workplace so we can attract and retain the workforce we need to be out there in the community more? We have folks looking at technology in a different way. We have more folks collaborating than I think we've ever seen. And they've always been pretty darn good at collaborating despite what some do think. Going into next year, because we know about certain challenges and there could be others, that's why this is so urgent. We don't know what's going to happen in November in the election. I wish that weren't so tethered to the fate of the health and human services sector, but it absolutely is. It absolutely is. We know that American Rescue Plan Act dollars will dry up if they haven't already for certain municipalities and certainly for the state. We've been planning for that as best we can. We know you're navigating that too. But it's these other pieces. It's that governmental piece, what's going to happen with the economy. We've been lucky so far. We seem to be experiencing a soft landing, but as with everything, it all feels very precarious depending on, do we go one way or another? And there are other factors that are creating higher and higher costs, and one of them, and I want to make sure we talk about this a little bit too, is a good problem for most, but it's a significant problem for our sector, and that's the growth that our community has been experiencing and is going to continue experiencing at a more accelerated rate over the rest of this decade. And that is already putting greater demand on our members, and that's only going to increase too. And it's that supply and demand you talked about. We're making the investments in infrastructure we need to make, and those are going to have all sorts of direct and indirect benefits for our sector and for the people they employ and the people they serve. That's fantastic. We support those. We need to be making similar investments in the people that are employed at our agencies and the agencies themselves so they can meet that demand. We talk a lot about when will things stabilize? When will that demand finally level out? Well, it will. It hasn't yet, but it will. But even if it does in this community, even if it does, the percentage of people in need might go down, but the number of people in need is going to keep going up because of that growth. And that's what we have to be making investments in. That's what we have to be doing. That's what we can do if we choose to do it. The same way we did in 2020 when we're dealing with these unprecedented problems and we poured money fast into the sector to help people navigate what they were navigating and help the agencies go through it. Not one agency closed their doors in this community in 2020 because we responded so darn well. We have to keep doing that. Let me close with some hope. We asked our folks what was giving them hope right now. I'm not going to read each of these. I want to read the last one. We came together during COVID-19 and worked to address health and the social drivers to meet our community's needs in a more focused and holistic way. We can do it with the same passion, drive, and spirit now. I think that's our call. I think that's what this council wants to do. I think that's what this city wants to do. I think that's what the county wants to do. We just have to do it. We just have to do it. Our folks can't wait anymore. We have got to act. We have to have that urgency and get this done. We have to fund the sector in a sustainable and significant way. We have to give your teams the resources to support the community as we continue growing so that no one has to be in need in this community anymore. That's all I've got. Thank you.
Thank you so much for that very insightful presentation. I know probably most of the people in the room are feeling the strain of that, but it's another thing too to see it really numerically kind of captured like that. And it's what's also really fascinating is it so almost exactly mirrors workforce data that I've seen at the state level too. And so it's the alignment, it's almost uncanny. Before I do have a couple questions. Before I ask them, though, I just wanted to open it up. Did either of my colleagues, and also would like to recognize Councilmember Bankston, who is also our chair of our Finance Committee, everyone. So thank you so much for being here today. Questions or comments? No? So just a couple of quick questions that kind of pinged to me while you were talking. Do you have a sense of across, it was 91 or 93? 93 respondents. Did you survey to see how many vacancies might exist across those organizations?
Yeah, I think the answer was 750, which is the best figure we've had in the years we've been asking this survey, and it's still a substantial amount. And I'll reinforce, we're seeing our members have those challenges up and down, whether at the executive level or at the front line. I think some of the specialty positions have been particularly challenging in filling those roles. The hospitals are recruiting away a lot of our agency social workers because they can pay triple and they can give benefits and they get pet insurance, they get 3 months off, they get massages, et cetera, et cetera. Our folks can't compete with that. You think I'm kidding. Ohio Health is spending $1.5 billion in cash on buildings right now. That's the kind of the resource they've got, and they're pulling away our folks. Our folks are training them, and then they're going to the hospitals, and I understand that. At the C-suite level, I don't have a current figure, but something like 80 of our agencies in the last 4.5 years have a new CEO today compared to March of 2020. And the vast majority of them have not been a nonprofit CEO previously. That represents both an opportunity and a challenge as well, but that workforce piece and filling those roles continues to be a challenge.
And it's just wild to me to think about 750 full-time employee vacancies across our sector just here at the local level. And with you mentioning that's the best number that we've seen in a couple of years, I mean, you just can't imagine turnover like that is sustainable, a year after year after year.
Yeah, that's right. It's a continuous challenge for our folks to have to train and retrain. That creates inefficiencies. That creates challenges in terms of service delivery too. Clients build a relationship with the social worker or caseworker that they're engaged with, and then that person goes and you have to start all over again. That creates unique challenges. I want to say, though, one of the interesting things that I think has developed, though, as those changes in the sector have happened, I think there's a lot of new collaboration that's been driven by some of that change as well. New agencies are working together, and I want to give some credit to our folks in a very unique way. I don't want any of this to come across as everything is bad. I get accused of being the nattering nabob of negativity enough. Despite these challenges, this is still a sector that employs 20,000 people in this community, that generates $2 billion in annual revenue in this community, and that is achieving extraordinary things in individual people's lives. And the number of agencies that touch someone's life as they go from where they start, when they first come through an agency's doors, to where they go, is extraordinary. I just heard a story about one person. I'm not allowed to talk about it at all. But as soon as they talk about it, I'm going to share it with everybody because it brought me to tears last night, brought my team to tears this morning. The work that they're doing is amazing. We just want to do more of it. Yep. We just want to help more people. That's all these folks want to do.
Okay. Well, I'm looking forward to working hand in glove with you to figure out how we can do that, how we can solve some of these challenges. So I want to thank you very much for co-hosting today's event with us. And with that, I will move on. Is there anything else? Nothing? Oh, go ahead.
Yeah. Thank you, Madam Chair, for bringing us all together here for this critical conversation. And Mr. Corey, thank you for all the work that you are doing in the sector. I think you mentioned something in your slide, and I apologize, I got here late. Can you just talk about where you're seeing opportunities for efficiencies? And also, I think thinking about the sector, are there conversations about how we wrap our arms around some of these smaller organizations that are popping up? I mean, and I see them as more niches that are popping up, as maybe street by street or some particular need that they don't seem that they are getting somewhere else. How do we utilize the sector, especially some of our, I think, our legacy institutions that have the infrastructure, to really wrap our arms around those smaller nonprofits, to bring them in so that we can start to streamline some of our back house infrastructure while we also perform those needs in those different varying degrees, whether it be larger in scale or smaller in scale from a neighborhood and place-based scenario.
Yeah, thanks for the question, Councilmember. First, our agencies have lots of ideas on efficiencies, and a lot of them are trying various things out. I've heard and seen the most in the real estate space of most efforts being done there to save dollars and create efficiencies with agencies trying to co-locate and identify ways to deliver services concurrently and efficiently. There's lots of interest in figuring out the health insurance mountain and getting over that. We have done lots of study into that and explored various options, and there's no perfect solution out there, but it is a substantial cost increase and benefits, workforce retainment piece for a lot of our agencies, no matter their size. We have to figure that out. A lot of our agencies are exploring technological opportunities to create efficiencies, to improve communication, to improve referrals, things of that nature. But I will have a full accounting of all of that when we publish this full report in a couple of weeks, a month, et cetera, and happy to continue that part of the conversation. In terms of supporting smaller organizations, as you know, we have organizations that are over 100 years old, and we have organizations that are 100 days old, and they're all trying to meet a need. Some agencies are multi-service, some are very laser-focused, as you said, on niche areas. And I think trying to find those partnerships and facilitating those partnerships can be a helpful way for those agencies to be maximally important. Trying to find ways for services to be complementary of one another, I think is something valuable that we can be striving toward, and providing efficiencies in terms of operations. And that's where we've been grateful to take our members' lead in identifying some back office resources and cost savings and stand those up in partnership with the city and the Columbus Foundation, things we've done separately but concurrently. I think those are opportunities. I think the real estate space is interesting. I think there are opportunities in energy efficiency as we navigate global warming and its unique and disproportionate effects on our membership and the people they employ and serve, and on and on. But at the end of the day, it's investments in people, programs, and infrastructure. No matter the size of the agency, they're going to make the difference. We have to be doing all of those things, not just one or the other. And I think the sector has to be at the table with some of the other initiatives that are moving, not coming to the table after the fact, to help address those things before they become emergencies and crises. I think we're all very enthusiastic about the advancements that are being made in housing. It has to keep coming. It has to keep coming faster. We're grateful to Carly Booz's leadership at AHACO in that front, among others. But we have to be doing more and faster. And that's nobody's fault. It's just the situation that we're in. We're growing too fast to do anything other than that. Thanks, Councilmember.
Well, and to that point, what you're talking about is innovation at the agency level and at the systems level. And it's really hard to innovate when 1 in 4 organizations don't have a savings account. Just like any other business,
That's right.
In order to be able to grow and scale and be innovative, you have to have money in the bank to do
Right.
that and to make those investments. And so I think, it's just all so interwoven, isn't it?
Absolutely.
Well, thank you very much. And I'm sure we'll have more questions for you after we get through some speakers. At this point, I would really like to welcome Tracy Ross up to the podium here. She is the Director of Neighborhood Ministries with Broad Street Presbyterian Church. And Ms. Ross, the floor is yours now.
Thank you. Good afternoon. And first, I want to take this opportunity to thank you, Council Member and Council Member Bankston and Date, Arkauer for the opportunity to talk to you a little bit about and share the life of a small faith-based organization here. So as Michael was talking about size, I was thinking of our organization. Broad Street Presbyterian Church has been in the city for over 137 years, providing outreach services to Columbus residents. We presently focus on two things and only two things: food and housing, those basic needs. For 53 years, our food pantry has been operating on the Near East Side. We're open from 8:30 to 10:30, 5 days a week. We currently are serving about 53 families per day, and food justice is so essential in the work that we do. Just to give you some historical data to compare averages so you can understand this growth, in 2023, we served 48 families. 2022 was 46, and during the pandemic, when there were supports available for families, that number was around 39. So 56 families. And I know anybody who's been to the grocery store know the cost of food right now. Every week, the pantry, we distribute 270 containers of milk, 270 dozen eggs, and if you're counting eggs, that's 3,240 eggs. It's a lot of eggs. We provide meat, milk, eggs, shelf-stable items to our neighbors. It's not all we do. We also we have started doing deliveries. So we deliver meal kits to over 300 seniors and working families unable to come to the pantry during normal business hours. Because of our commitment to provide fresh and healthy options for our shoppers, over 15 years ago, we began a small community garden, which started our journey into local agriculture. Today, we distribute fresh produce from that garden, but we've also started a program where we are purchasing produce directly from local farmers in the community. A few years ago, in collaboration with some of our Near East partners, we began working to increase fresh food production by supporting interested community gardeners, helping them move from growing out of passion to growing for profit, purchasing their fresh produce and hosting monthly farmers markets on our grounds. We are committed and believe how important it is, no matter if you're coming to our pantry, that you get the fresh, best options available. And we're trying everything to make sure that happens. With all this said, Council Member, I must note that the demand is at an all-time high, as you saw the numbers, forcing us to turn away about 3 to 9 families each day, which breaks our heart. I'm going to move to our housing stabilization work. For the first 6 months of the year, Compass at Broad Street, which has been serving the community for over 40 years, has provided rental and utility assistance to over 675 residents. And thanks to the City of Columbus, Deputy Director Hannah Jones, and the work that we've been able to do through the ERA funding, we have been able to support those number of folks. But we know that funding will not last forever. During the same time, we logged over 2,000 calls, 400 walk-ins, and we are serving 26 different zip codes in the city. Again, the storyline here is unfortunately we're turning away residents, 165 over that same 6-month period. Keep in mind, all this is happening, small staff, devoted volunteers, limited budget. I believe our city does have a bright and boundless future, but only when every resident can thrive, when those who desire to have an affordable place to call home and sufficient nourishing food for their bodies, we all win. It's just basic stuff, right? I believe we can truly do more together. Thank you.
Thank you so much for the work that you do, first and foremost, for so many, many, many years. And did anyone have any questions? I don't think so. Okay. Well, we will move on. And again, thank you. The work you do is so absolutely critical. Our next speaker that is to come up to the podium here is Kristen Schaub, our CEO of Greenleaf. If you'd like to join us at the podium, and thank you again for attending today.
Good
Good afternoon. Thank you, council members, for the opportunity to speak today. Greenleaf Job Training Services is a nonprofit organization that provides employment support services to people with individuals and other obstacles to employment here in Central Ohio. We believe everyone has value, no matter where they've been, where they want to go, or what obstacles they face. In 2023, the U.S. Bureau of Labor Statistics reported that people with disabilities made up about 13% of the U.S. population, and their unemployment rate was more than double that of non-disabled individuals. Despite this disparity, workforce participation among people with disabilities has reached an all-time high, with many eager to work but lacking the support to do so. The pandemic highlighted the benefits of practices like remote work and job sharing for both employers and employees. These are ideas that people with disabilities have been advocating for years. In the first half of 2024, our organization experienced a 38% increase in program referrals over the same period in 2023. However, our staffing levels have remained largely unchanged and our funding has stagnated. So over the past 5 years, most of our services have only seen a 2.6% increase in reimbursement rates. I don't have to tell you how this compares to inflation alone. Despite these challenges, we consider ourselves fortunate. We are not one of the agencies anticipating a deficit this year. Greenleaf's dedicated, mission-driven staff continue to provide invaluable support, often helping participants secure entry-level jobs that pay only slightly less than their own wages, and these are people with college degrees and years of experience. Additionally, we were, to Michael's point, able to renegotiate our lease this year. We've cut our rental cost by 80%, so we can divert more resources to our participants and to our staff. In 2023, with the higher rent, over 70% of our expenses went directly to our staff, and this percentage is obviously expected to increase this year. So this situation is not sustainable. While we are managing it for now, many of our fellow nonprofits, as you've heard, are struggling even more. If the current trends in referrals and stagnant funding persist, our future is uncertain. Our staff, no matter how dedicated, need financial stability to continue their work effectively. They cannot fully support our participants if they're worried about keeping the lights on at home and putting food on the table. Columbus, as a rapidly growing region, needs workers, and people with disabilities are ready and they're willing to contribute. They just need the support that organizations like ours provide. And for years, we've been asked to do more with less, and we have hit the tipping point. Without significant changes in funding, our entire community will suffer. Thank you.
So much. I actually do have a question, I guess. It's so funny because our sector is so diverse with so many different subsectors in it, and certainly workforce and the work that you are doing is a piece of that, right? And so when we're thinking about opportunities to infuse revenue into that subsector, the workforce subsector, what revenue streams do you see that exist beyond just, city general fund dollars, or is there opportunity for revenue with the businesses also that are contracting with you? I'm assuming you probably are getting it, but I'm just not familiar with that side of it.
So the vast majority of our revenue comes through contracts with the state of Ohio. So we work primarily with opportunities for Ohioans with disabilities and the Department of Developmental Disabilities. And at the state level, there have been historic investments in services to people with disabilities. But beyond that, yes, I think with businesses, putting people back to work adds people to the payroll. It's filling critical needs. In a lot of ways, it should be an easy sell. They're creating a larger tax base by putting more workers back into the economy. So I think businesses are a big part of it. Foundations, of course, grants, individual donors.
All right. At this time, we'll invite Bo Chilton, the CEO of Impact Community Action, to the podium. Thank you so much for being here, Mr. Chilton. The floor is yours.
Thank you, Councilmember Green, for the opportunity. Councilmember Banks and Day Archer. Appreciate the opportunity to give testimony, and thank you to Michael Corey for organizing us. I looked at that picture that he showed when we first were founded, and I was one of the few who was in that picture originally. As a founding member of the chamber, I served as the first vice president. under Steve Votaw. And so to see our progress and to see how far we've come it fills my heart with joy, let me just say. I serve as the CEO of Impact Community Action, where our mission is to fight poverty by providing hope, inspiring help, and real opportunities for self-sufficiency. There are 1,100 community action agencies across the nation, 48 here in the state of Ohio. Collectively, we serve all 88 counties. We are the designated community action agency for Franklin County. We have a staff of about 110, an operating budget now of about $30 million, and we serve over 30,000 customers annually. I'd like to just dive into kind of what happened during the pandemic as it relates to rental assistance. That is something that we became very well known for and tried to partner with a lot of people to address the need. But to give context, in 2019, we had a rental assistance budget of $300,000 and we served 250 people. Fast forward to January of 2020, we were ramping up trying to figure out how do we create a collective impact model. We were having conversations with Job and Family Services, with Broad Street. Jeff Bill was a facilitator for us, working closely with the Community Shelter Board and figuring out how do we take a collective approach to eviction prevention. So some of that work was already underway. And then when the pandemic hit, we received significant federal resources by virtue of some of the federal dollars that we already received, and then there were dollars given to the state. Immediately, we contacted our partners and figured out how can we work together? How can we leverage our resources to serve people? And so we were kind of first on the scene to hit the ground running. One of the things that gave us an advantage in responding at that time is that we were declared essential services, so we never did shut down. We did have some staff go home initially, but after 30 days, we had to call everyone back. So we've been open the whole time and haven't really worked from home and didn't have to go through that adjustment. As I said, in 2019, we had a budget of $300,000 and served 250 people. From June of 2020 to present day, in concert with our partners, we distributed over $120 million and served over 40,000 people. I cannot tell you what it took to build the infrastructure necessary to go from the 300,000 to over 120 million, but we could not have done it without the partners in this room and some who are not in this room. We really tried to work together, and we created a model that really became the kind of the predecessor of the current model that the city now holds. And so Hannah and Kim Stans and all of those folks were great partners as we were building out that model. It felt good to be able to address the need. For the first time, we saw vacancies in our shelter system. We saw a significant decline in childhood poverty. Virtually everyone who came to us, we were able to say yes. We were able to find a way to yes. That became our mantra. Let's find our way to yes. If it's no today, let's figure out a way. And we were able to do that. And I think our community counted on us as a network to be able to do that. Now the resources have shrunk. We get people who are coming and saying, well, what will I do? And for the first time, we're saying, we're not sure. We can only do what we can do, and we can refer you to our partners, but we're all feeling the same pressure. We're having to turn people away who are desperate. And that sense of desperation has a growing volatility and frustration that unfortunately our frontline staff are the ones who bear the brunt of that. And so that's something that we're deeply concerned is the resiliency and the mental health of our community and of our staff who are dealing with people in crisis daily. And that contributes to burnout. When we talk about the fierce competition for talent, and when we get good people, it's hard to keep good people when they're facing such challenging situations. And so I do have the good fortune to serve on a number of boards that gives me a very unique perspective on things. I serve on the board of Aspire, formerly the Workforce Development Board of Central Ohio, really looking at our workforce system across the region. I sit on the board of Homeport, building a lot of affordable housing, and the board of Affordable Housing Alliance of Central Ohio. Carly Booz again and Michael Corey especially were very instrumental in us strategically planning how do we bring as many resources to our county as possible. And I will tell you, if people were paying very close attention to how this whole thing went down at the state gave away a lot of dollars back to the federal government that we could have used, and that was very short-sighted, I believe. But there were those who believed it was time to give back the pandemic relief dollars. The pandemic's over, and it's time to kind of push people back to work. But what we did do here in this county, we coordinated with the city, with the county, and with Michael and Carly Booz to make sure that we were hitting all of the metrics necessary to leverage whatever dollars remained at the state that could potentially go back. And because of that, the state had about $150 million that had to be reallocated. The city of Columbus and Franklin County received $102 million of that $150. And I can tell you a lot of my colleagues around the state were raising eyebrows wondering how we did that. It was because we worked collectively to make sure that we showed the evidence that we can spend these dollars. The need is out there. But of course we know the need is still out there, but the resources are not. I did have the good fortune to be around a long time. I remember being in this very seat where these staff people are sitting now when I served as the legislative aide to Councilmember Charlita Tavares at the time, who chaired Health, Housing, and Human Services. And one of the things that we were working towards is how do we have a more sustainable funding source? After leaving here and then becoming a nonprofit leader at the Urban League and then on to Impact Community Action, had the good fortune to serve on the Funding Review Advisory Council, which looked at funding for the arts, the human services, and for Experience Columbus. And so from that came some recommendations. I would love to see that committee reconvene so that we can look at a holistic approach that gets public sector as well as private sector investment. And so the last thing that I'll leave with is just responding to a couple of questions, because we know that the funding resources are necessary. But beyond that, what are some of the things that the city might be able to do that could be helpful? I want to say continue to support the Human Service Chamber. The Human Service Chamber is, when I served with Charlita before the chamber was here, I can tell you what happened. A lot of agencies would say, yes, we speak with one voice, but then individually those agencies would come down and lobby for their own funding. There really was no collective approach. And so now under the Human Service Chamber, we really do have that. I love the program that the city implemented that allows small nonprofits, 1 million or less, to have access to fundraising training and workshops. Those are things that I think the city can continue to invest in. We need more help with professional services, low-cost professional services that will allow us to look at our operations and see if we need to right size or what things we can do. Looking at our data analytics and helping us in those capacities would be something. Also, continuing to leverage public sector investments and influence to push for greater collaboration and investment from the private sector. I can say that in the past, developers would come and ask us to partner, and their idea of partnership was, can you write us a letter so that we can get extra points on our credit application? And then there was really no true partnership, or it was a small role. I can say that through efforts with different developers and demands, that council members have pushed developers to have meaningful partnerships, and good things have come out of that. One I can point to is that we have a partnership with Woda Cooper. Now, we were able to bring value by applying for tax credits from OFA and securing those, but we were brought in as a developer, not just a service partner. And so we have small equity in the deal, and we have an affordable housing complex that's coming on 102 units of affordable housing in Whitehall, the Enclave on Main, that will come online at the end of this year. I know that it was some of the influence of our public sector who encouraged that. The other thing that I would ask for is, in addition to the access to professional services, which helps our organizations build capacity around data governance and analysis, risk mitigation, financial forecasting. Those are things that I think could be helpful in addition to a more comprehensive review of how we can have sustainable funding long term. Thank you.
Thank you so much for joining us today and for your testimony. I took lots of notes, and that was a testimony of high highs and very low lows. I was like tearing up a little bit, but that's just because I'm a social worker. I cry all the time. I wanted to just, I wanted really fast to talk about or ask you a question about, so the way that you are describing the work that you do, it really, really sounds, I mean, like that's a dramatic figure from $300,000 to $120 million. I mean, the Herculean effort that it must have taken to accommodate that amount of growth in an immediate amount of time, it's like almost unfathomable for me. But I want to talk about, with this network that you have helped build out, what I am seeing as someone who has a clinical background, I'm seeing, I kind of feel like sometimes social workers or people, licensed clinicians, we're kind of like the soup du jour, like everybody wants one. And we're oftentimes getting recruited into positions where we're not working at the top of our licensure status. And especially as we're talking about all these workforce challenges, I've been thinking a lot about workforce pipeline, right, which I know is also a lot of work happening at the state level. But even at a local level, if we have systems that we have built that are functioning really well, do you see opportunity maybe where we could grow our own workforce at the local level, like bring in people that have a desire for service, but not the 4-year college degree to perform those tasks? We can do that training. We can prepare people to be able to provide that case management or that navigation through our systems, right? What would your thoughts be about that?
Oh, absolutely. And I will say that we are working to build we actually have created the Workforce Development Network. Scott Johnson is now the executive director. We brought together 16 nonprofit organizations who are in the workforce development space, trying to figure out, it includes Goodwill, Urban League, Jewish Family Service, other nonprofit workforce development providers, but taking the collective impact approach to how do we build systems and how do we start to grow our own pipeline? One of the things that we've talked about is creating an employer resource network, where it's very much the thing that you're talking about, taking a licensed professional who can have a direct connection to some of our corporate partners and be that liaison to all of the social services and social safety net, and have the private sector invest in that. That's another way to bring in private sector investment into our human services.
Let's talk more about that offline. And then, I feel the arts and human services are the only, entire sectors that are always just expected to work for free. We're always expected to provide that consultation or that crisis intervention at the drop of a hat without any reimbursement for it. So I hear that. Well, with that, unless any of my colleagues have any comments, then I will move on to Oyama Garrison. And I'm very passionate about all the work you do at Mary Haven as someone with an alcohol and drug specialization. And so the floor is yours.
Well, first and foremost, let me just say thank you to Council Member and Committee Chair Green. Thank you as well to our additional Council Members, Bankson and Nancy Day Oshawa, for all of your support and what you're doing And I, too, would like to thank our Executive Director and CEO, if you will, Michael Corey, for always being an incredible advocate for the work that we do in the Health and Human Services sector. Again, my name is Oyama Garrison, and I'd like to say I have the honor and privilege of serving as the CEO for Maryhaven, which you should be incredibly proud, because Maryhaven has just been recently named by Newsweek as one of the nation's top 250 addiction treatment centers in the entire nation out of tens of thousands of addiction centers, and the #1 nonprofit addiction center in Central Ohio. So absolutely honored to be here. Maryhaven was founded in 1953, and let me just share with you, since that date and time, we've served over 350,000 individuals and families. We've touched residents from 78 of Ohio's 88 counties, and we have quantified to have had over a $1 billion economic impact in this entire state, and we continue to do more. And so naturally, most people tend to know me for quoting a ton of stats. And I will certainly share a lot of that information with you because it's relative and it's important. But today, I'm going to ask you to allow me to share a story. And I want to share the story from Susie. So Susie was born and raised here in Central Ohio. And at a young age, she heard the call from community leaders and residents and decided to become a social worker. She wanted to make a meaningful difference in the lives of others. She joined a nonprofit organization making less than $10 an hour. And over the years, saw her pay rate increase to $15 an hour. She's barely making it. So she takes on a part-time job to assist with raising her family as the cost of childcare escalates. She dreams one day of buying her first home. So in the meantime, she rents. Her rent when she started in the behavioral health care sector was $450 a month. Her rent today, since that period in time, over $1,800 a month. Same space. Her dreams of home ownership are fading as the balance between escalating cost of goods and services, childcare, and rent evaporates her income. She takes on another side hustle, while at the same time witnessing the needs for services at her primary job increase significantly. Why? Because more people are coming forward with substance use disorder, which includes illicit drugs, alcoholism, gambling, and gaming. And certainly seeing more people rise with mental health challenges than ever before, and homelessness. She recalls almost becoming a member of what we call the working nonprofit homeless class and is in need of help. She recalls that and shared that it was in that moment she received aid from another nonprofit to avoid becoming a member of that nonprofit working homeless class. Meanwhile, the organization she works for, once a thriving entity, has seen their cost in goods skyrocket. They have had a shortage in workforce availability. They have also seen donations come down from major corporations as dollars shift. As a note, women experiencing alcoholism, domestic violence, homelessness, and human trafficking has gone up over 200% since the pandemic. The impacts and pressures are real. This is not an urban issue, it's an all-American issue. The struggle for good working people to survive is real. The struggle for nonprofits to survive is real. The collapse of nonprofit entities will have a ripple effect that we will see with homelessness escalating, poverty skyrocketing, mental health compounding beyond current levels, substance use disorder would reach new heights, and people will turn to illicit drugs, alcohol, prescriptions, gambling, and other ways to cope. The nonprofit sector alone, with the faith-based community, are the two primary areas and sectors that people turn to when they need help. I'm proud. I'm proud that the City of Columbus and Franklin County recognizes the role that nonprofits play and continue to provide resources for existing organizations while exploring other options in this continuum of care. These investments are helping sustain and change lives. Unfortunately, the need continues to intensify, and in-kind contributions are no longer covering escalating cost. That includes gas, electricity, rent, supplies, and all the other goods and services. If a nonprofit posts a job, the fill time has gone from a few weeks to several months, if it gets filled at all. If a nonprofit posts a job, they have to stretch their budget to meet the demand of new labor rates, and that does not always guarantee that new person's going to stay or come with the level of experience that is required. But yes, the city's investment into helping high school students matriculate is building a future workforce that someday will be ready for us. If a nonprofit faces financial challenges because of uncontrollable external forces, as demand and costs increase, they are left to find ways to supplement the gap. As resources from funders get diverted to other causes, because guess what? It's escalating everywhere. Nonprofits, unlike for-profits, cannot raise capital the same way. If a nonprofit asks for support, they are challenged with scrutiny and asking if we are running the business efficiently and effectively. Well, yes, we are. Yes, we are. We get a ton done. We get a ton done with virtually nothing and continue to be asked to do more. When some support is given, the grant reporting can be so stringent and time-consuming that it is no longer a benefit to the organization. Susie decides to leave the sector and go make $20 an hour at the local warehouse sorting. She no longer is living her passion and dream to be of service, but rather working to survive. She's still barely making it as her rent just went up to $2,100 a month. And childcare for two, one under the age of 5, and the other needing latchkey services, is now running her over $800 a month. So what can you do? Build a revenue stream that supports the health and human services sector, along with our shelters. Thank you for the competitive bid grant process that provides additional resources to those who qualify and are selected. Explore new ways to offset the rising cost of childcare so that the working class can reduce the stress of having to work an extra job just to pay that single bill. Be it added, I don't know, local tax credits, grants, and employers making less than 500 or employers with 500 or less. Somehow or another, we got to get at a system that allows our employees to work a single job, commit to the service that a nonprofit is designed to do, because guess what? That is what we are about. Nonprofits are not designed the same way for-profits are. So we cannot make money in the same way, fashion, and form. When nonprofits were formed, they were formed with their hands out because people were lined up to support them. But the line is short. We need your help. Thank you.
Thank you. Thank you so much. Councilmember Bankton, do you have any questions or comments? No. It has been a dream of mine this past 9 months to do a Katie Porter, like nonprofit math, how she does on the floor of Congress, if you've seen that. And I feel like you just did it better than I ever could. So thank you so much for doing that. And I just want, to your point, the rising cost of living not the rising, we talk about the rising cost of housing a lot, but just really the rising cost of existing in any community, but especially our community right now is out of control. And one other thing I think that we're really trying to focus on right now is our Link Us initiative. And we know that families on average are spending about $12,000 a year just on transportation related costs alone. And so to your point, I think we are fully committed to looking for those opportunities and continuing to get creative and how can we improve the cost of living in this community in real and tangible ways while we're also increasing our investment in the important work that you're doing. So
Grateful.
Yeah.
So thank you.
Thank you. Thank you so much. And then finally, our next invited guest needs no introduction. She is a change maker and a champion for our unsheltered population. Shannon Isom, the floor is yours.
Good afternoon, Madam Committee Chair Green, and good afternoon to the esteemed Council Member Bankston. I want to thank you for having this State of Human Service Sector meeting, and I certainly want to thank Director Corey for bringing us all here together. I want to do a special shout out to all of the service providers who are here that show up and fill this chamber and show up each and every single moment of every single day. Thank you. My name is Shannon Isom. I am representing the Community Shelter Board. I am its president and CEO, and I'm hoping that not only am I representing one of the new CEOs in which Director Corey mentioned, but also that I am representing one of the few CEOs who was a CEO prior to nonprofit direct service work. I know what this work is. I hope then to also give voice to the noble, the commendable, the long-suffering, and the dedicated 16 partner agencies that contract to do this work, as well as all the other service partners that do this work informally on behalf of homelessness, destabilization of housing, and those to be housed, moving through the throes of both class, race, gender, mental health, and other ills. I'll say that we are always appreciative of being invited to the podium and compelled to respond to any and to all opportunities to discuss the critical funding needs and the workforce challenges in which we all face. We know that there are improvements that can be done right now for this sector, and so I appreciate being able to outline them with levels of urgency and need, and to suggest actionable steps that ensure that these strides that we can make can not only be significant in addressing our homelessness in our community, but significant for the workforce in which fuels services. I ask that as we go through these action items, that the first thing that I ask that we all do, which is really important, is that we just agree. That we agree that the point of right now is actually right now, and that it is not any time later. Our most pressing issue, which I believe you've heard already, is that the continuation of funding for emergency shelters is imperative, that the impending end of ARPA funding that we are facing right now is a $9 million gap. I have to call out that this council has been friendly to that ask. Thank you. But it is also crucial to note that the money is not there, and so we must deploy other ways in which to fill the gap. It is imperative that we fill the gap because it is a workforce impact. Our shelter partners are experiencing severe instability in the frontline workers. They need to be paid more. They need to be aligned to the growing economic boom here within our community, and they need to ensure that their basic needs are equally as addressed. Secondly, there are staffing shortages. Those things include overnight shifts that often deploy strategic managers, strategic executive decision makers to cover those gaps. You mentioned, Councilwoman Green, the importance of a social worker. It is important that our emergency shelter is right-sized with the right people doing the right work at the right time. So our action that we're urging the council is to allocate the necessary gap filling of $9 million, but to do it not just by continuing it, but to sustain it. And that ensures that we will have consistent quality care for our community members. I'm going to mention the Winter Warming Center funding. This is something that came last year, but I am telling you that it has been successful with what I believe is the center of the Community Shelter Board's mission, which is to provide right-sized options for those that are on the land. And those right-sized options mean that we have something readied, that we have people deployed to help and assist, that we have an option, that we're not massaging others into the option, but we have the options that's needed, which means that slows down, that program slows down for those who have been on the land. We are seeing, even today, good success from the Warming Center strategy. So what our ask is that we request the council really assure us that $1.2 million for the winter warming centers will be there. Number one reason why we do winter warming centers is to ensure that no one dies from hypothermia. No one. It's the number one reason. And the number two reason is to ensure that those that are unsheltered have shelter. Number three, that we address the increase in homelessness. That we must reduce by 2028 what is already being predicted by the assessment to happen here within this region. If you haven't heard it already, the predictive modeling has shown that we can expect a 68% increase in unsheltered homelessness and a 16% increase in total homelessness by 2028. We are 3.5 years away from that, and I will tell you that you can ask any of these service providers, and they'll tell you that absolutely that this is true. They feel it every day. We must, right now, put together a couple of strategies. They can be deployed today, and they are additive. And what we know is that once achieved, they can decrease total homelessness by 38%. Here are some of the recommendations quickly: that we can reduce entries into homelessness by 25% for adults by implementing preventative measures, providing supportive services, and that those preventative measures are sustained. We must have non-congregate sheltering. I have asked this body, but have asked as many people that can listen, that we must have hotels and motels that are ready for us, not only for our homelessness, but also for crisis. We must invest into more permanent supportive housing and rapid rehousing. We have a number for this: 375 units of PSH and 250 more rapid rehousing slots for adults will achieve close to a 40% decrease in homelessness. We ask that the council support these efforts. And then finally, in closing, many of these things you have heard before, and at times that many of us may feel like that we are with council and with our peers speaking to the choir, or maybe preaching to the choir. But I'm asking that, because we know that we can deploy these things right now, because we know that we can have a decrease once deployed of right now, because we know we need sustainable funding, that maybe the preaching and the talking is ready for the choir to sing. So thank you.
Thank you so much. I think we have a lot more conversations to have just in terms of how we can most effectively prepare. 4 years in government world is like tomorrow, right? When we're looking at the significant increase. And so the time is now. That's all I'll say. Councilmember Bankston? No? Thank you so much for being here. Okay, so at this time, we're going to move into the public speaker portion of the agenda. And I just can't tell you how much it means to have such broad support from so many organizations and so many people that I respect so deeply in this room right now. So thank you, thank you, thank you. I, like all of you, also feel like I work for Michael Corey these days, so which is wonderful. So our first person on our public speaker list here is Cmte from Festa.
Hello, I'm so honored to be here. It's my first time here. Thank you so much for having me. I'm Cmte. In 2007, God called me, a call on my life to serve, love, and feed 2,000 children facing poverty in my suburban town here in Central Ohio, and to bring the community with me. I've dedicated my life to supporting children and their families as they move out of poverty this generation. I started Festa, formerly Sun Ministries, from nothing. I've led and raised the dollars to fund our life-changing programs, especially our 3-generation family English program, for 17 years tenaciously. I've led through multiple recessions, actually started in one, much political uncertainty, and a global pandemic. Never stopping and always growing our in-person programming. Now we are serving 1,289 families, households, on a $1.3 million budget, with 2 social enterprises that we started in 23. 2025 was to be the first time that we dipped into our savings account that we started back in 2018. In the last 8 months, I've seen donations the lowest I've ever seen them. I'm looking at the real possibility of having to shrink our programs in a sad season where our immigrant neighbors are being demonized. 60% of our funding has come from donations by people like me and you. Today, due to fear of the future and inflation, we've seen a dramatic decrease in these donations. We've also had businesses cut our donations in half, saying they had a bad year. Churches are warning us they may have to decrease their gifts this fall. From January to March, we applied for $1.5 million in grants, and so far, we've gotten 1. We believe this is a secondary result of drying up of ARPA funds, resulting in the cumulative demand from nonprofits being much greater. For example, the Franklin County Community Partners Grant had $3.7 million to give away. They had over $400 million in asks. They said it's the largest they've ever seen. Meanwhile, amazing things are happening in our community, and the need is growing. I'm grounded each day in hope for tomorrow when I go to our Festa programs and look into the beautiful faces of the children and their families that we serve, our newest neighbors from over 55 countries of origin and 39 local zip codes. Like the 3 10-year-old children I sat and had lunch with at our free summer lunch camp with Adult English this summer, who came from Algeria only 6 months ago, and they were speaking to me in English. They didn't know a word when they got here. They told me they love the United States because of the opportunities they have here, unlike the opportunities that they felt they had none of in their country. This year, we increased the number of people served by 67% by opening 1 additional 3-generation family English program to serve infants and grandparents. Do I have to stop? Okay, I have 1 more minute. In the 14th largest city in the country, the fastest growing, we need 20 locations of this to serve 10,000 people and recruit 6,000 volunteers to build relationships across lines of difference. Morpsey says half of the migration in Columbus is from people outside the U.S. 4% of foreign-born people here can find an English program, and English is a huge barrier to work. Festa is removing that barrier. For 17 years, I've seen Columbus be such a caring and giving community to individuals, from individuals, churches, businesses, and the city and local government. We have a waiting list we never get through, and as a founder and community change maker, I'm grateful to the city, so thankful, and ask the city to help us ask our community to give. Thank you.
Okay, next person on the agenda here, or people, are Maggie Hallett and Dr. Amina Kemavor from Mental Health America, and AdamH.
Good afternoon, Chair Green and Councilmember Bankston. My name is Maggie Hallett, and I'm the Associate Director of Mental Health America of Ohio. Thank you for convening us today. In 2016, our organization was brought into conversations about the challenges behavioral health employers were facing, particularly the alarming rates of turnover. We've since conducted 135 workplace health assessments with over 70 community behavioral health agencies across Ohio, including 18 here in Franklin County, representing over 3,000 local behavioral health employees. Through this work, we know two things to be true across the board. Behavioral health employees are not paid enough, and they have unrealistic, unmanageable workloads. They're living a vicious cycle that none of them have the power to change. Community behavioral health employers are relying on Medicaid and other insurance reimbursements to keep their lights on. But because behavioral health reimbursement rates are too low, pay is too low, and workloads are too high. Because workloads are too high, there's little time for proper training, supervisory support, or other workplace best practices that compel employees to stay. It's no wonder people quit. And when they quit, their workloads are redistributed to other employees who likely, in turn, also burn out and quit. In behavioral health, we know that building trust and rapport with a client is paramount to the therapeutic relationship. This cycle of burnout and turnover directly impacts the care clients receive. As Michael was saying earlier, how can a client get support they need when they have a new case manager every 3 months? How many times do they have to trust a new person enough to tell them their story, to share their trauma, and then to be traumatized again when another relationship they've built ends abruptly? If care for the clients isn't motivating enough, this cycle also deeply impacts agencies' bottom line. For every employee lost, it costs approximately 30 to 50% of their salary to refill the position. The 10% Medicaid increase that was approved in last year's state budget, which, by the way, was the first Medicaid increase for mental health services in over 20 years, might not even cover the cost of turnover. It's definitely not translating to a 10% pay increase for employees. There's a lot of support right now for recruitment initiatives to bring more people into the behavioral health field. But if we don't address the immediate retention issues, why would we assume these new professionals will stay in the field given the conditions in which they're expected to work? As part of the AdamH Behavioral Health Workforce Council, we are working hard to support these organizations in Central Ohio, but we need help from decision makers who can impact system-wide change. We must figure out a way to create sustained funding for behavioral health workers to move with the cost of living in Central Ohio in a way that doesn't cause them to burn out. In the meantime, we'll keep helping the organizations become the best versions of themselves. We'll help them provide healthy work cultures for their employees in the hopes that these incremental changes matter enough to keep them in the field. And now I'm going to turn it over to Dr. Amina Kimavor.
Good afternoon, Chair Green and members of Columbus City Council. My name is Dr. Amina Kimavor. I serve as the Vice President for Advocacy and Engagement at the Alcohol, Drug, and Mental Health Board of Franklin County. Thank you for allowing me to speak with you today. AdamH's role is to plan, fund, and evaluate the behavioral health services in Franklin County. And while we have 6 systems of care, today I'm here to talk about workforce. You are an emotional being. You've been hurting for years. You see anti-mental health stigma campaigns, suicide prevention campaigns, and seeking help finally resonates with you. So you reach out to start treatment. You do not give up during the required nuances to get properly linked. While putting everything in place, your mental pain is still escalating, only to learn that due to workforce shortages, your first appointment is 3 months away. You wait. Your first appointment has finally arrived. You are excited because since childhood, you've carried around an agonizing anchor in your soul, and now you finally feel good about getting help. For 3 months, you never miss a counseling appointment. You're feeling better. At the beginning of a session, your counselor now tells you that your next appointment may be your last with them. Your counselor, the only person who knows the vulnerable details of your life, can no longer provide care because they are not able to earn a livable wage working in community behavioral health. You've heard about this, and now it's happening to you. Throughout my almost 30 years of experience in behavioral health, the absolute most painful act I've ever had to do is informing clients that their clinician is leaving, and now they face more months-long wait for a new one. This is the reality of community behavioral health workforce in Franklin County. In 2022, to address workforce shortages, Adam H. convened a countywide workforce development council prioritizing partnerships with local providers and key community stakeholders. Throughout our discussions, it became clear that the most pressing needs are as follows: recruitment and retention of diverse individuals in community behavioral health, creating a healthier workplace where employees feel valued, advocacy, and systemic change. Approaching 2025, the Council is on track to launch the following: a student cohort in partnership with local institutions of higher education, creating diverse career pathways across the behavioral health continuum in Franklin County. Our first leadership development cohort, training up our next generation of behavioral health professionals, and advocacy coalition to strategically advocate for equitable health care in behavioral health funding and policies. Grateful for our council's dedication to easing workforce pain points. It is still not enough. Our behavioral health workforce requires systemic transformational support. We need sustainable funding that is in alignment with the diversity of our community behavioral health care system. Anything less is a Band-Aid on an open wound. 1 in 5 American adults suffers from mental illness. 1 in 6 youth suffer from mental illness. 1 in 7 young adults suffer from addiction. We are that open wound. Thank you for the opportunity to testify, and we are here to answer any questions that you may have.
Thank you so much. Would love to know more how we can support your workforce initiatives. And then also, to your point, Maggie, I believe it was a 12.5% increase in community-based services. So give credit where credit is due to the DeWine administration for really championing that. But we know that's just kept organizations out of the red. It hasn't really translated into those salary increases that we know are so desperately needed. So I think it's important to talk about that and then use that information as an opportunity to kind of, again, stack hands with all of our partners and our funding entities and work with the Adam board to pick up efficiencies and see what we can do to bridge those gaps. So thank you so much.
Absolutely. Thank you.
No. Oh, go. Yes. Councilmember Bankston.
No question, but I just wanted to make sure that I said some brief comments, Madam Chair, because I do have to run. But I just wanted to say to all the folks here in this room, thank you. For the work that you do. Many folks know me in this room as well with a different hat on, and so I understand the work that you do intimately. And I've said this before in different settings, but I want to make sure it's on the record. The work that you all do is not an amenity. The human service sector and the safety net, whatever word you want to use it is not an amenity of being a big city. It is a necessity. And therefore, we have to come together to figure out how we make sure that it is sustainable. Because at the end of the day, that net is there because of policies, broken policies that have made the situations that all of us have inherited. And be clear, these are policies not that this body has adopted, but our predecessors and folks who sat in these same seats and created these types of policies, both at the local, state, and federal level. And so it's going to take all of us at all of those levels to make sure that we do this together, lock and step. And so I know we are committed, and we have conversations about this continuously, about how do we have that sustainable source here locally, but we have to think bigger. And our state partners have to be involved. Our federal partners have to be involved. And we have to figure out how we bring down more federal dollars into this community, because we can't do it alone. And we are the fastest growing. And we are the economic engine of this state. And so we need them to also be beside us. We'll also need us to start thinking as a region. I'm challenging my partners in Dublin, in Bexley, and all of these other well-resourced neighborhoods that we need you to be a part of the solution as well, whether it be affordable housing, whether it be human services, whether it be mental health and drug addiction. All of these don't stop at the city limits. They're all of our issues that we all must own together collectively. And so I just want to thank you all for, again, continuing to be here, to bang the drum. It has not fallen deaf ears. It has not fallen deaf ears. And as we continue to grow as a city, we absolutely will continue to have competing interests that we have to balance. But we have to ask ourselves, what type of community do we want to be? And we get to make that decision today. So again, thank you all for the work that you're doing, the urgency. We feel it, we hear you, and we're going to roll up our sleeves and get to work and do it. I will also ask you this. As you're thinking about the funding source, and we're thinking about the funding source, we know that that's one piece of it. I ask that you challenge us and work with us to figure out what are the policies to fix the systemic issues and systemic inequities in our community that continue to allow these types of things to persist. And help us attack this both from a resource standpoint, but also from a systemic standpoint, so that we can have a community I think that we all deserve to live in and that my son deserves to inherit. So again, thank you all for your work. I appreciate it tremendously. Thank you again, Chair. When I tell you you have a champion for this sector, and if you didn't know, she is a social worker because she's going to tell you that, but you have a tremendous champion both out in front, but also behind the scenes, who is speaking this every single day. And so I'm so proud to be here. I'm so proud to serve with her, and also to call her a friend. But more importantly, I am honored for her to be here because she pushes. She pushes us to think about who we are and for us to have a conscience. And so, again, thank you, Madam Chair. Thank you all for being here. And I look forward to the hard work ahead. Thank you.
Thank you.
Thank you, Councilmember. Okay, that's all the questions and comments from me right now. So we will go with next on the list, Karen Mosenter. Am I saying that correctly or incorrectly? And then following that is Tanya Fullwider on deck, if you will. Thank you so much for being here.
You got it right. So yes, I'm Karen Mosenter from Jewish Family Services, and I can confirm what you have heard from my colleagues, and I'm sure what you'll continue to hear today. And I know I'm preaching to the choir with you, and so I want to give you some ammunition and focus on what is too often neglected for our sector, which is our impact. I'm not just talking about the impact on individual lives. I'm not just talking about the impact that we have as employers, but the impact of the work that we do. All too often, we are thought of as do-gooders, and we do a lot of good, but we're also economic engines for this community. So I want to give 3 quick examples of what that looks like at Jewish Family Services. Number 1 is how targeted investments in our work with older adults is improving the social determinants of health for them. It's decreasing social isolation. It's reducing doctor visits and hospital stays. It's helping them remain independent and age in place, which we know is much more cost effective for the system than congregate care. And it ensures that their family members can remain in the workplace. Number 2 is integrating and employing refugees and immigrants in our community who are filling jobs for local employers. There's a 2015 city-funded study that showed that refugees contributed $1.6 billion annually to our local economy, and that's old data. Newer data from New American Economy shows that immigrants and refugees in Central Ohio are in our MSA are better educated, more likely to be in the labor force, and more likely to start businesses than their U.S.-born counterparts. Number 3 is investments in workforce development and the just tremendous ROI that has. Over the last 5 years, Jewish Family Services has helped over 3,100 people get jobs. That has generated $116 million in annual wages. Those folks are paying around $29 million annually in taxes, and that was on investments in our workforce programs of $11.5 million. So finance is not my area of expertise, but I'm pretty confident that $116 million in wages on $11.5 million in investments is a darn good return on investment. And that doesn't take into account the really hard to quantify impacts of things like people who have jobs have health insurance. They can pay taxes. They are saving for cars and homes, and they're spending in local businesses. So that's the ROI on the investment. And the other side is, what's the cost of not investing in our sector? And that, as you heard, a strain on the shelter system, the healthcare system, the criminal justice system, public benefits system, and an inability to meet the demand for a workforce that will meet the needs of the projected growth of our region. So smart investments in our sector now, by the public, by private sector, by the philanthropic sector, mean less need to pour money into basic needs later. Investments in the human service sector are critical for Central Ohio to continue to grow and thrive. Thank you.
And thank you so much for the way that you kind of talked about those numbers, because I think I will say historically in government, I think like the old head politicians, right, they've looked at this work, I talk about this a lot, they've looked at this work and investments in this work like charity or philanthropy, not as strategic investments in the future growth of our community, the same way that we talk about other types of infrastructure investments. This is our human infrastructure. And so I can't wait to share that stat with others.
Thank you.
Thank you. Okay, Tanya Fullwider from Mental Health America of Ohio. Welcome to the podium. The floor is yours.
Good afternoon. Thank you, Chair Green. My name is Tanya Fullwider, and I serve as the Executive Director of Mental Health America of Ohio, or MHA Ohio, a nonprofit that's proudly called Columbus home since 1956. Over the past dozen years that I've worked for the agency in various roles, so one of those new executives that Michael mentioned, I've seen our agency grow from a small team of 7 to a dedicated staff of over 30, working tirelessly to meet the mental health needs of our community. With those 68 years of compassionate service, MHA Ohio plays a crucial role in bridging gaps left by the traditional care system. As a longstanding member of the National Mental Health America's 200 affiliates, MHA Ohio plays an essential provides mental health resources and supports for families and individuals along the journey to well-being. We also tackle systemic issues by managing Franklin County's Suicide Prevention Coalition, leading the Ohio Perinatal Mental Health Task Force, and as Maggie mentioned, strengthening Ohio's behavioral health workforce. 2 of our programs have been recognized nationally with Innovation in Care Awards. In 2023 alone, MHA Ohio served over 7,000 individuals in Columbus and across Ohio. We provided mental health care, peer support and education, supported clinical care providers, and advanced suicide prevention initiatives. The demand for our services continues to grow, yet the resources to meet this demand, as you've heard, are increasingly strained. Since COVID-19, the need for mental health supports has been a perpetual part of the conversation. We witness challenges in access to care, lost time at work, and lives lost to suicide and overdose across many demographics, from children and teens to new mothers and birthing persons and older adults. However, our ability to respond to this need is often hindered and time-limited by time-limited, high-barrier funding streams. These fragmented sources of support force us to spend valuable time and resources navigating bureaucratic obstacles rather than focusing on delivering essential services. And like many nonprofits, we're a people-powered organization. Our primary expenses and our most significant and valuable product are the dedicated professionals who deliver these life-saving services. And despite this, the workforce and funding available are not keeping pace, as you've heard, with the growing demand and increasing costs. So thank you for your time and consideration of accessible, transparent, sustained, and multi-year funding for organizations like MHA Ohio. And with my 18 seconds, I want to answer a question you asked earlier about licensed professionals and workforce options that are not are beyond, the master level. And I just want to remind about certified peer support specialists as well as community health workers. That are a wonderful way that we can continue to add to our workforce here.
Yeah. Thank you so much for mentioning that. I think sometimes people from outside of our field, even at the city, I know I was talking to somebody from the Department of Development, like, hey, we want to hire a social worker. And I'm like, you don't need a social worker for that role. Let's figure out how we can either partner with an organization. You can have opportunities to access a full range of services, or looking at a community health worker, peer supporter, some other type of QMHS worker, where we're not pulling someone from another part of the workforce, but we're using everything that we have in front of us. Okay, well, thank you so much for being here today. I appreciate you. Sorry I missed the last perinatal task force meeting too. Okay. Brandy Alisa is next on the list. And I'm so sorry if I got the enunciation of that incorrectly. From Habitat for Humanity. Thank you so much for being here. Oh, and then following Brandy next is going to be Austin Hill.
Good afternoon, Chairperson Green. Thank you for hosting this important conversation. My name is Brandy Alisa. You did say it correctly. And I'm the president and CEO of Habitat for Humanity Mid-Ohio. We connect people to hope and opportunity through obtaining and maintaining affordable housing, more specifically, affordable home ownership. We bring together public, nonprofit, private, and faith organizations together along with volunteers and families to fund and build that housing. The themes demonstrated in the State of the Sector survey certainly apply to Habitat, but let me share a couple examples and how they've been played out. Over the last 5 years, we've received 606 applications for new homes. Of those, we've had the ability and the capacity and resources to serve 75. So of those 606 requests, we've funded and built 75 homes over the past 5 years. We also do home repairs. Over the past 5 years, we've received 725 applications for repairs, and of those, we've served 397. We currently have 132 people waiting for their home repairs to be assessed, and these are often people that have significant code and safety violations. Speaking of home repair, annually we receive about 8 to 10 requests that are bigger in scope than a repair. They're really true home rehabilitation projects that cost about $100,000 to $200,000. I sat in with our team yesterday to review some of these applications and pictures, and to see the state of these homes can really bring tears to your eyes. It's devastating. We don't have the capacity to serve all of those, and if left unserved, these homes eventually probably land up in the city's land bank and perpetuate a cycle that we're, quite frankly, stuck in. We are battling rising construction costs, which have grown 40% over the past 5 years, a competitive fundraising landscape, but along with growing demand, as demonstrated in the myriad of housing research and studies that are available. I'm going to state the obvious here, but with more and sustainable funding and capacity, we would be able to serve more families through building homes, repairing homes, and rehabilitating homes, and growing our wraparound and ongoing services and trainings to families to help ensure they're successful in home ownership, but also create communities. Solving the affordable housing crisis is bigger than any one entity, but Habitat hopes to be a leader in the space through collaboration, partnerships, policy reform, and funding across sectors. Thank you.
Thank you so much. That's an astonishing number. 40% of construction costs have raised, and I imagine funding flowing in has remained stagnant, and probably donations, like everyone else, are down.
Yes.
I want to say I know in the course of this hearing it feels redundant even just to keep pointing out the same things, but I think also sometimes in government people don't see on the surface how prevalent these challenges are. And if an organization comes forward, I think Ms. Ross, did you mention this, or someone in their testimony had mentioned about, Oyama had mentioned that if we come forward, right, like there's just an assumption that we don't understand how basic math works, how addition and subtraction work, or what the red numbers are compared to the green numbers on the spreadsheet mean. But we do. We just don't have enough green ones. And so it is so valuable to be able to have this conversation today so that, you know, for my colleagues that are going to watch this back later that weren't able to be here, those that were, they can hear that this is a problem across the entire sector at every subsector level. When we're talking about housing, we're talking about food and pantry resources, we're talking about alcohol and drug, mental health, that we have a real crisis right at our doorstep that we need to address. So thank you.
Thank you.
Okay, Austin Hill from the Refuge is here. And then following Austin, we're going to have Diana Russell from ETSS.
All right, so I am such an elder millennial, I don't have a laptop, I had to write it down. So that's just who I am. So my name's Austin Hill, I work at the Refuge. For context, we're a men's addiction recovery program that provides wraparound services for men over the age of 18. We're also completely free and don't require insurance because we're a crazy nonprofit. We are celebrating our 25th year, so many of you in this room are familiar with the work we do, but I would like to use this time to use the Refuge as an example of what it means when nonprofits receive funding in new creative ways. We just get stuff done. In the past year, we have added clinical staff, we've added behavioral health services, we have had our facilities remodeled in various different ways because of the creativity and flexibility of our staff and partners to think outside of the box. Because the problem is not, like, one of the things about nonprofit people is we look at a problem, we look at a broken community, the chaos, the fray, whatever you want to call it, and all of us, for some really weird reason, look at that and be like, that's what I want to go do and that's what I want to handle. And guess what? You're not going to get paid for it really well. It's like, oh, that's okay. We'll still do it because we know it's right. And the funding for nonprofits and what everybody in this room, leaders here, know that if we increase the funding, we will do a lot more good. So it's not about us just like, hey, let us do the same thing. We, as the Refuge as an example, have seen how the problem in addiction has changed, and so we are addressing it differently. The funding is going to have to change, so we need to look at it differently. And so I want to say confidently that the Refuge has, and everyone else in here is also really good at, is being very creative with the shifting sands of the crap we walk through, because we care about what we're doing, because we know it's the right thing to do, not because it's flashy. Like, one of the reasons why workforce is so hard to maintain is because this work is hard. Full stop. That's just what it is. We're not doing this for money. And the ones that stick through it are not like holier than thou or better than. It's just like we are fortunate enough to have supports from other places. So we are willing to be creative in how we do it. So I would encourage, if there is an opportunity to invest more, to continue investing. Nonprofits will figure out how to do it really difficult work really, really well. Man, I did that in like 2.5 minutes.
The quickest I've ever heard you talk, Austin. Can you just talk a little bit actually about what you're seeing in terms of the increased needs and the demand for services in your space?
Yeah, so our census has almost tripled in 2 years. That was just because COVID kind of messed with how people get into addiction. So we saw like, holy crap, we have to adjust how we do things. So we've seen a large increase in demand of intake. And we've also, because of the shifts we've made, we've seen a dramatic increase in our retention rate. We used to see about 40% of the guys who come in make it through the first 30 days. Our retention rate for this year is above 60%. So in our creativity and how we've adjusted our programming to meet the needs of the guys coming in, we're seeing a higher retention rate. And everybody that we see has been through multiple recoveries. So there's very few people that we have in our programming that this is their first try at rehab. So the need is out there, and they're just trying to find the right place to heal. Mm-hmm.
Well, thank you for that. And I know when you're working with those residential programs, there's so much of the work that you do, even if you, which I know you are, accepting insurance, mm-hmm. but just not requiring it, right?
Yeah.
Yeah. But so many pieces of the work that are not funded at all. Like until I was down at Maryhaven walking around, I did not realize that there's no reimbursement or any coverage for the 3 meals a day that people most certainly have to eat in that facility. Most people from our field know that, unlike the hospital system, right, there's no reimbursement for your facility costs, but it just, every one of those things is, you have to kind of rob Peter to pay Paul to make it all work. And I hope, if nothing else, what we're able to kind of demonstrate today is just the very significant complexities of that. So thank you.
Thank you.
And then Ms. Diana Russell from ETSS. And then following her is Rachel Lustig from Lutheran Social Services. Thank you so much for being here today.
Thank you for this opportunity to speak. I stand here before you today to bring attention to the critical and urgent situation that ETSS Tewahedo Social Services is facing. We have helped over 75,000 immigrants and refugees in the last 20 years. In recent months, we have experienced an unprecedented and unplanned influx of refugees and immigrants at our service sites. Just last month, our north site alone was designed to serve 60 clients' caseload was overwhelmed with 200 individuals seeking help. These are families and individuals from Haiti, Mauritania, and countries across South and Central America, fleeing hardships and seeking hope in our city. Our staff, who have always been dedicated to providing essential services like ESOL, employment support, and assistance with benefits such as food stamps and Medicaid, are now stretched beyond their limits. The strain on our resources is immense. We're lacking food donations and nearly depleted our clothing supplies and our hygiene products for our children and our teens and our women. We're running dangerously low every day. The cost of maintaining our facilities has skyrocketed due to the increased traffic and space occupancy. We are doing everything we can, but our infrastructure is beyond capacity. We've distributed bus passes to students and clients and provided essentials like diapers for babies, but we are now at a breaking point. Our staff is overworked and burned out, working multiple sites. We are losing talented employees who simply can't keep up with the demand. Our budget is struggling, and we lack the general operating funds necessary to handle these unexpected emergency situations. The challenge of housing and transporting new arrivals, especially unaccompanied children, is growing every day. We need your help. Our city must step up and assess the capacity of all of our organizations to ensure that we can continue to provide the critical support these new arrivals need. We are asking for immediate financial assistance, increased access to resources, and a collaborative effort to address this crisis. These individuals have come to our city seeking safety and a chance at a better life. It is our responsibility to ensure that they are met with dignity and the support they deserve. With your help, we can make that happen. Thank you.
Thank you for being here. Rachel Lustig from Lutheran Social Services, and then following her is Sonia Thiesing.
Good afternoon, Madam Chair. It's a pleasure to be here. Thank you so much for convening this important conversation. I have the honor of serving as the President and CEO of Lutheran Social Services. Over the course of a year, we serve 80,000 people. Each day in Central Ohio, there are hundreds of people who rely on us for health care. There are over 1,000 who rely on us for shelter, either through our emergency shelters or affordable housing. There are several tens of thousands of people who turn to us for emergency assistance, either food or information and referral. I have been a resident of Central Ohio for about 11 years. And one of the things that I love about Central Ohio is how much excitement and positivity that there is in our community about what it is to be from this city. And we have, as a community, invested mightily in our economic development efforts, and it is something to be proud of. But we have not lined that up with the corresponding investment in the human infrastructure that is essential to helping our people be able to take advantage of the jobs and the opportunity that there now exists in our community. By way of one example, Lutheran Social Services has the honor of running Faith Mission, one of our community's long-standing legacy homeless shelters. Lutheran Social Services has not received an increase in public reimbursement since 2006. The demand and the homelessness crisis that we are experiencing, Shannon Isom, our leader at the Community Shelter Board, did a beautiful job illustrating the challenges that we are experiencing are interconnected. You hear about mental health, you hear about housing, you hear about food assistance. We have to stand up as a sector together to be able to do this work, because the people who I am serving either in the homeless shelter or who are coming to the food pantry are showing up the next day at ETSS. You can't rob Peter to pay Paul across any of our. So I ask, and Councilmember Bankston rightly asked us, what can we do from the policy perspective? We are here to stand up and be your advocates on important legislative investments, like Zone In and the second phase of that needs to happen yesterday. We are here to lock arms with our other community partners. We want to be a part of the success. But it shouldn't be that we are asking for our own assistance. We're here investing in the people that are our community. Thank you for your time.
Thank you so much for that. And then I totally agree. We have invested a lot in economic development. And when I think about economic development too, I don't even just think about the small business support and all of those things. We're talking about economic development in the context of unmet and untreated mental health needs. Our very own Nationwide Children's Hospital, they released the On Our Sleeve study just a couple of years ago that found that 52% of parents are missing at least 2 days of work to deal with a month, 2 days of work a month to deal with their child's unmet mental health needs. And that has a significant workforce and economic development impact just in and of itself, regardless of any investment. So, thank you
You're
very
right.
much.
It's not just the human services sector that's talking about workforce challenges. It's everybody. Yeah. And this lack of investment in the human infrastructure is impacting all of us.
Yeah. And none of it occurs in a vacuum. Well, thank you very much for being here. I appreciate you so much and the work you do. Okay, Ms. Sonia Thiesing, and then next we have Will Petrick after her. Sonia, thank you for being here today.
Thank you. Good afternoon. My name is Sonia Thiesing, and I'm the Executive Director of Huckleberry House. Thank you, Councilmember Green, for hosting us today and for the support of Huckleberry House. Huck House cares for the most vulnerable in our community, our youth. To do this work, we must remain hopeful. Our incredible team of 73 dedicated staffers work every day helping youth plan for their futures, and that's hope in action. However, the challenges the staff faces every day, caring for young people who no one else is caring for, is hard. Hope is hard. Huckleberry House echoes the challenges lifted up by the State of the Sector report. The census in our teen crisis shelter increased 8% over last year, despite our too often having to cap the census due to staff shortages. It is crushing to think a young person may show up at our door, but because we are understaffed, we cannot provide them with safe shelter. Demand for us is not just the physical presence of the young person, but also their social, emotional needs. They require the care only the human service sector can provide. Our finances are tighter than they have ever been. If everything doesn't go as planned, and it never does, we will again face a deficit at the end of this fiscal year. While we were able to budget a very small cost of living increase this year, we still have staff members who face the benefits cliff if they are paid too much, who are couch surfing because they are paid too little, or have a second job because they cannot afford to live on their Huck House salary. At the end of the day, we are facing immense challenges to do our work, challenges that stand in the way of our ability to provide the best services the youth need and deserve. But I stand here today ever hopeful, because while hope is hard, it is also full of optimism. We continue to be optimistic about our work and about the futures of the young people we serve. This optimism comes from the success stories we hear and see every day. Recently, a young person was in our teen crisis shelter for 37 days. 37 days, due to significant conflict in the home, addiction issues, and general safety concerns. During their time at Huck House, we provided the basic needs of safe shelter, food, and clothing. But most importantly, we wrapped them with case management and one-on-one counseling. Huck House connected the young person and their family to appropriate agencies for safe support in the home. And they maintained these connections and participated in ongoing counseling. After 37 days, the young person reunified with their family and with those adequate supports in place to address their needs and allowing them to remain intact as a family. It took 37 days of care for this young person, which costs a lot of money, and we did this for all 404 teens who stayed with us last year. This is what optimistic hope looks like. We must invest as a community in our sector and in one another to ensure we can continue to do so much good for so many. Thank you.
Thank you so much. When I think about the funding and the wage issues that you were just talking about, I'm also acutely aware, and I think a lot about things like Intel moving into our community that will have a starting salary of $120,000 a year, right? And then we think about our workforce challenges as they exist today, and the shortages and the issues with recruitment and retention that we're seeing, and then you compare that to that, who are we going to get to come into this workforce if we're not realistic about the needs that we can pretty much guarantee are going to continue to exist as our city continues to grow? I think it just is something we have to be incredibly thoughtful of. So I'm grateful to you for raising that.
Thank you.
Thank you. So now Will Petrick from Rise Together Innovation Institute, and then following him is Heidi Weaver Smith.
Thank you. Chair Green and Human Service Sector colleagues, my name is Will Petrick. I'm the Director of Advocacy and Policy with Rise Together Innovation Institute. Our vision is a Franklin County where every resident has the resources and opportunities to thrive. But today, an estimated 204,000 Columbus residents live at or below 125% of the federal poverty level. By working together and investing in the human service sector, we can ensure all residents can live with dignity and economic stability. That's why Rise Together is involved with the Community Information Exchange Initiative. It's a county-wide effort to improve how our community coordinates and delivers human services. The CIE aims to make it easier for residents to get the resources they need and to prevent residents from falling into crisis. I just want to thank you and thank Columbus City Council and Mayor Ginther for your support for this critical initiative. Throughout this process and this initiative, the leadership of the CIE has worked directly to co-design with residents and caseworkers to better understand their experiences. And so just want to share some key pain points that they have shared through the process. One, navigating the system is often confusing and frustrating. We know residents face roadblocks like difficulty finding services, understanding eligibility, excessive paperwork, and long wait lists. We've also heard from caseworkers that they're overextended. We've heard this today. Some have caseloads that just make it challenging to provide the support that residents need, and the heavy workload leads to burnout and high turnover. A resident seeking support must apply, likely if they lose their job, to multiple agencies to get support for childcare, for food, for rental assistance, for workforce support. And each of those agencies have their own application, their own needs assessment, their own intake process, and that siloed approach is challenging and burdensome for residents and for staff. And so residents and caseworkers also shared objectives for what could save them time and reduce that stress and burnout. And so they've shared ideas for saving time in terms of completing the application, connecting with people over the phone or in person, ideas for how to conduct a needs assessment that might be more efficient or more centralized. So these changes could enable caseworkers to spend more of their time providing the critical services that residents need. We also know sharing data and information across the ecosystem is going to be key to enhancing coordination and reducing duplicative work. Rise Together collaborated with 6 local agencies to assess their data capacity and identified key challenges such as reliance on manual data processes, siloed data systems, and difficulties in tracking outcomes. We also identified opportunities for improvement, including automating data processes, integrating systems for better outcome tracking, and investing in resources and training to enhance data management and exchange capabilities, again, allowing staff to focus more of their time on delivering those critical services. Just to conclude, together we can make sure that all of us live with a strong foundation of economic security. To achieve this, we must invest in the human services sector and continue to innovate to meet the needs of residents. We can integrate technology solutions and co-design those technology solutions to meet and anticipate the needs of residents, of caseworkers, and human service agencies. Thank you all, everyone in this room, so much for your commitment to this work and to the people of Central Ohio. I welcome any questions that you have.
Awesome. Thank you so much. I will say I'm a little bit nervous of technology right now. I don't know if you've heard, but we've had some issues at the city. So
That's fair.
More to discuss and how that intersects with the work that you're doing. I actually do have a couple questions. The first one being related to, or maybe just one. I know you had also shared over some written testimony, and there were some really great anecdotes in there in terms of just the actual feedback that you've received, both on the customer end as well as on the provider end. And I was wondering if you might be able to share some of those for some of the folks that are watching online.
Yeah, absolutely. So just for context on the feedback, the Mid-Ohio Food Collective conducted research and surveyed 200 residents that have participated in human services locally. And Smart Columbus and Rise Together with the Community Information Exchange over the last 8 months has been engaging what we call the Experience Council. And this is, again, residents and caseworkers with direct lived experience. So these quotes, they're all anonymous, but these are all quotes from residents and caseworkers. So kind of going back to the challenges that we heard from both residents and caseworkers, I think a big part of this, the whole purpose for us coming together, caseworkers are overextended. So one caseworker shared, quote, "Currently my caseload is 60 residents. I'm required to meet clients for 22 hours every week. It's an intense workload that's taken a toll on me mentally." In terms of the challenge for residents, struggling to find services and understand if they qualify, quote, "Finding help is like going through a maze. You don't know how or where to start or which path to go down. Each turn uncovers more things I just don't know." So that was one of the themes, you don't know what you don't know, that we heard. Another quote, "It was kind of hard because we didn't know if we qualify for certain services." In terms of just the process, we have a few different quotes from both residents and caseworkers. So one resident said, "It's difficult because you have to call so many different numbers and set up so many appointments which can be far away." Other residents and caseworkers talked about long wait lists. So one caseworker shared, quote, "If I refer a client to other agencies, they might face long wait lists or no funding. So the client has to wait until the agency can help, and I don't know when that will be." One resident also said, and this was a struggle with kind of understanding once they go through an application process, understanding if, they're going to get the service or not. So one resident said, quote, "If I went online, there was no feedback. If given a phone number to call, no one ever called me back." I also want to highlight that this is not reflective of all the agencies in Central Ohio, but this is what we heard directly from some residents. So one other, the Mid-Ohio Food Collective survey found that 79% of residents agree that the social services they qualify for are relevant to their needs. And one resident shared in that, quote, "The location they send you to should be in your neighborhood, not where you got to wait for the bus and transfer 3 times. It's crazy." So those are just some of the quotes and feedback that we heard directly from residents and caseworkers.
Wow, I'm really glad that you shared that. And this is only the 4th time that I've teared up sitting here tonight. But I also just want, I want to kind of echo, I don't think it's negatively reflective on our sector. Our community is in crisis, and our community service sector is equally in crisis. And so, you know, now is the time where we have to act to make sure that we have the resources and the staff. And I said this when we were going through the budgeting process and talking about CSB and the funding that is desperately needed to support our emergency shelter system. You know, if we don't make these investments, then what happens if there's no one there to pick up that phone when that person calls in crisis, and no one to help connect them the places that they need to go? And so I think that's just my goal and intention. The only other question that I have for you is, so the CIE, which we're really excited to have been able to invest in significantly, and are even more excited to be a collaborator on that project as we move forward. I know it's in the early stages, and so this is a long-term investment, which is great. You know, you plant a tree today and 20 years from now you have shade, and I don't think this is going to take 20 years, but I do think that we have a ways to go. In the feedback that you have collected from both the sector as well as the clients, the people that we're serving, do you have a sense of, is there something that we can be doing today to help improve those efficiencies? Or if not, then maybe that's something we can continue to talk about and look at the information you've collected through that lens. I just want to know, what more can I do to be supporting the sector in alleviating some of those very significant challenges in the short term, while we're also continuing to invest in those long-term strategies?
That is a great question. And, you know, one thing I think is critical in terms of today is just what we've heard today, right? Like, we need more investment in the human services sector. And, you know, one of the things that part of the vision for the CIE is all of us working together, all of us sharing information to better meet the needs of residents. And so one other thing that, again, we're looking at is what are the technology investments needed? What is the data capacity? And so, again, this is kind of early on. We've done some initial learning, but again, we had a pilot with 6 different agencies to look at data capacity, and broadly, the findings were, you know, some of the major challenges were manual data processes. So a lot of people spending time entering data, exporting and importing information. We know that those manual data processes are very time consuming and also potentially prone to human error. So as much as we can automate data processes, that can save time for staff, time for the caseworkers. And then in terms of, you know, data quality and cleaning, there are tools that can help agencies ensure that accuracy, consistency, reliability. One other thing that we've broadly seen is, you know, in the sector, my advocacy hero is Tracy Nahra, and she talks about, like, kids and families don't come in parts and pieces. And that is how we've structured our society, and how, again, with state and federal policy, it's food, it's housing, it's childcare, it's mental health. And, you know, I think our perspective is all of these are really critical to get to health, well-being, economic stability. And so, you know, the systems that we use to provide those services basically have been created to, you know, communicate to funders and to track outputs of, you know, here's how many people we've served. And they're, you know, the systems are siloed. And so I think the vision for the CIE is integration and interoperability. And this also kind of connects with the ability to track outcomes and impact. And so moving more towards an integrated way of understanding and being able to really have a person-centered approach and tracking a resident across, a food bank, housing support, getting support from childcare, and seeing how that whole blend of services meets their needs or gets them to that stability. So that is also long-term work. So I kind of dodged your question a little bit, but I do think ultimately, again, the sector needs support for providing these services, but I think there's also investments that we can be advocating for around technology and around further integrating the human service sector.
Awesome. Well, and we can kind of loop back around too about, sorry, that question just came to me, but I imagine it probably will take a little bit more digging into, and it's also something that Michael, you and I can work together on too, if there's more we can be doing. So thank you. Thank you so much for being here. And I'm so glad that you were, because efficiency has been raised multiple times. So to speak specifically to the community information exchange is really helpful.
I appreciate the opportunity, and thank you so much.
Yeah, thank you. Okay, Heidi Weaver-Smith, and then our last person of the evening is Kayla Davis following her. I don't see you, Kayla. Oh, come on down. Hello, thank you so much for being here.
Thank you for having me. Councilmember Green, my name is Heidi Weaver-Smith. I'm the Executive Director of Little Bottoms Free Store, and we are located on West Park Avenue in the Franklinton neighborhood. We provide essential baby supplies to disadvantaged Franklin County families, including diapers, wipes, clothing, formula, and more. Last year, we served over 1,000 unique children and provided over 56,000 diapers, nearly 13,000 outfits, and 1,300 coats and jackets to young children and babies in need. We were birthed out of a desire to address the social drivers of health that create elevated infant mortality rates in our neighborhood. So we also have a variety of programming that seeks to support families that are most at risk for infant mortality. I'm speaking today to highlight our critical funding needs for Little Bottoms Free Store. First, we have an urgent need for additional staffing, like many of my colleagues, to facilitate resource connections and to provide additional service hours. I currently am the only paid staff member at Little Bottoms Free Store, and the demand is outpacing our capacity. We're also witnessing more diverse and pressing needs than ever before, and we're currently hiring for one additional part-time staff member, but our workload really justifies 2 full-time staff members, so we're staffing up at about a quarter of what we actually need right now. And as a result, we are having to face the real reality of potentially waitlisting families for our services. In 2022, we more than doubled our service numbers, and today we are serving 4 times the amount of families that we served when we started 5 years ago. Our most critical need is that we are at risk of losing the church building we currently occupy, which is listed for sale. Over the past year, we've been working diligently to secure funding and save up to purchase it. It is a valuable neighborhood asset, and it is really ideal for resolving some of these same concerns that many of my colleagues have voiced, and co-locating nonprofits in the building with us. We have partnered with Franklinton Development Association, who brings their expertise in community development and affordable housing to our project and provides strengthened infrastructure to our efforts as a small nonprofit. Our building offers over 20,000 square feet of space, an industrial kitchen, plentiful office spaces, and several large multi-purpose rooms. We're utilizing roughly half of that space right now, leaving plentiful space for other nonprofits like us to co-locate and collaborate together, while better supporting families in one space. Our proposed project is $2.5 million with an immediate need of $625,000 for acquisition. And we would serve as the primary tenant in that project, with FDA serving as the developer, and we estimate that we could complete the project by 2027. I think it's a real opportunity for our community, and I truly do not want to miss out on it. I hope that we can count on you and other members of the council to lend your support to this project and to Little Bottom's efforts more broadly. And I'm happy to take any questions you may have.
Just apologize because I know we have a meeting that has not been scheduled due to me. So I'm looking forward to talking more with you about that. And I've had conversations with Councilmember Bankston also. I think one thing that I'm trying to be thoughtful of, knowing that he and I both have been talking a lot about finding that sustainable revenue stream, right? But also B, that we haven't yet. And so thinking about the limited resources that we do have, and how can we be as thoughtful as we can in the way that we're investing them. I think historically local governments and, even at the state levels across the United States, whatever change is kind of left over at the end of the year gets kicked over into our human infrastructure, right? And so trying to look at this work through a very strategic lens has been something I've been very heavily focused on. And when we think about the possibility of helping purchase a 20,000 square foot building that then could go on to eliminate significant cost burden for space rental, not just for your organization, but other organizations, or, strategies like that, things like investments, like what Will was talking about, investments in technology that are going to significantly reduce costs to our agencies for those administrative tasks that take up so much time, and time is money, right? And so looking forward to talking to you more about that.
Likewise, I think it could be an innovative solution for many nonprofits like us that are facing those rising real estate costs and the dwindling inventory, and then the press and strain of our budgetary constraints right now. So Thank you for your time.
Thank you for being here. And last but not least, Miss Kayla Davis from A Step in the Right Direction in my hometown. I guess the Hilltop's not a town. I think it's a town in my neighborhood, the Hilltop.
Yeah, well, thank you for inviting me out and sharing this with me. I just want to kind of bring my perspective from more of a smaller grassroots nonprofit. So I'm the founder and executive director of A Step in the Right Direction. We have been running, this is our 5th year running. The first 3 years, we served 3,000 people with less than a $20,000 budget. Our 4th year last year, we served a little over 5,000 people with less than $50,000. This year, we've doubled our budget, so we'll be a little under $100,000, and most of that is through sponsorships, in-kind donations, and then we also did get a grant from City Council to support our hygiene-free store. And I bring this opportunity to share because we have one of the 2 hygiene programs in Columbus. Our hygiene program right now only serves specifically the West Side, and to give you guys an idea, the Hilltop has over 40,000 residents, and we're only serving those zip codes over there. Right now, because of our hygiene program and the need, we are seeing more asks from other communities outside of the West Side, and because our funding is restricted, we're having to turn those people away. Now, my goal is for 2025 that we are going to open our hygiene store up to all of the zip codes in Columbus and Franklin County, but be able to open it also up to more hours. And I have been doing this for 5 years, and I am an unpaid staff member. So we technically do not have any paid staff members on hand. I also work a full-time job where I work 40 hours a week at another local nonprofit here in Columbus. So giving my time to the nonprofit is a lot of work, especially when I'm working 20, 30 hours a week on top of my 40 hours a week to ensure that we're continuously serving the West Side community. We're looking at probably serving almost 10,000 people, and in the first quarter of our hygiene store, we've served 1,400 individuals, and we're continuing to serve more. So to give that idea and that vision that we are still continuing to fundraise, but like most of the wonderful people that are here today, funding is a lack thereof. We are grassroots, we are community-based, but a lot of our community members are lacking the funds to continue to support us. So now we're looking at other ways and other resources available to continue to serve us. So I just truly appreciate you guys shining light on this topic, especially for us smaller grassroots organizations. And with my organization, the smaller ones that aren't as developed as mine are reaching out to me for my guidance and my support. So what we do is we'll share our resources with them so that they don't have to go looking elsewhere. And when we talk about those collaborations, that's where those collaborations are important to me, because I'm helping these other smaller grassroots organizations continue to be successful that are also serving the clientele that we are too. So I appreciate you bringing this out today.
I very much appreciate you also. And I think, God, if you guys saw my notebook over here, it looks like the wall in A Beautiful Mind. It's just like none of it makes sense except to me. But I think that is the issue that you raised about the program. And when you think about the hygiene-free store, we oftentimes just think of like toothpaste and like toothbrushes or whatever, but like things like dish soap and home cleaning products, laundry detergent, which is so expensive, especially if you got a kid that has an allergy or a baby that needs a hypoallergenic formula or whatever. So expensive. And there's no other revenue stream that goes to support that work. And so I would be interested, Michael, when we're looking at what things we want to start evaluating, what other types of work like that has no revenue stream? We know emergency shelter is one. You know, what other things exist where we don't have really any sustainable funding whatsoever going into it, and that's one. So,
and I just want to share the opportunity that, you know, we're now seeing a older clientele coming in. We were seeing an average between 25 and 50. Now we're seeing those older folks that have Social Security, that are on a fixed income, and them coming into the hygiene store and saying, like, this is helping me stretch my dollar a little bit longer. Like, they don't have to spend the money on laundry soap. Cleaning products is one of our hottest items that we give out, and it's also one of the most expensive items that we give out. So giving them that opportunity, or the average family size that is coming in to see us is 5. And their income is less than $40,000. I can't even imagine, as a single mother with a child, making $40,000 and trying to make it, let alone having 5 people in the household to take care of. So just giving them that, you know, that extra stretch for them, not to have to stress out about the smallest things that some people don't even, you know, they don't worry about laundry soap or cleaning supplies or cleaning their house on a daily basis. But these folks are maybe able to clean their house once a week. And the devastation, so allowing us to be able to bring that to our West Side community, but then now it's a bigger ask because we now know that it is a need. So now we're figuring out, okay, how can we secure this funding, but also be able to hire folks to be able to do the work? Because at this point right now, if we don't make our fundraising goal, we're going to have to pull back some next year, and we may not be able to serve the amount of folks that we're expecting to serve for next year, even as a small grassroots organization.
Okay.
Thank you.
Well, that was our last public speaker. I'm going to offer the floor back to Michael Corey to say a few closing remarks, and then I have some notes. I didn't prepare remarks because I didn't know how I'd be feeling at the end of this, but I do have some thoughts that I will share and some commitments that I want to make to everyone that's still in this room that stuck with us throughout the hearing.
Thank you, Councilmember. I'll be brief, which I never am. I'm grateful to everyone who shared today. I'm grateful for the audience and the amplification of what they're sharing with you, the narratives and the numbers. And I think we're all thinking about, okay, what do we do next? How do we get this done? How fast can we get this done? What are the many things we need to get done? And I can tell you we're all in. We're ready to go. Whatever we need to do, whoever needs to hear this, whoever we need to rally to move to action, we're ready. But I'm just grateful for our team. I'm grateful for all of our bosses in this room. I'm grateful for your stick-to-itiveness with this and the other council members that are able to attend. Let's get to work.
First and foremost, Thank you very much, Michael, for your leadership and for, I feel like I have monopolized so much of your time. So any Human Service Chamber members in here, if you've been noticing a change, it's because of me. I'm the bad guy. But I just want to really thank you for your leadership. And it's been, I knew coming into this role that my number one goal, I think, talking about working in silos, I think in government, we look internally to our partners, our city departments or, the health department and development certainly, which are certainly key partners and stakeholders. But I knew that I wanted to have the chamber and to have our human service sector be like an extension of that work, because I think I talk about this a lot, I don't like to use the word nonprofit anymore because I think we marginalize our nonprofits, much like the communities that we're serving get marginalized. But I will say in the context of this, that our nonprofit organizations, they don't just get that 501c3 tax exempt status out of the kindness of our federal government's heart. They get it because there is a recognition that the work that you are doing, that we are all here to do, is an extension of our obligation as government to ensure the welfare of our constituency. And so in that regard, I see us all as very interconnected partners, and I'm so grateful for the partnership with the Chamber and with all the organizations that were here today and represented in this room. Also very much, and thank you for being here. You have no idea how impactful it is that you are all here in such great force. Also, thank you so much to my wonderful team, to Haley and Tigus back here, who are, they are actually my bosses, who really did all of the heavy lifting on pulling all of this together. And so thank you, ladies, so much, as well as to all of our team at council and for Mark and everyone for helping get this off the ground. The one thing that I want to say, so I want to talk about action. I started out at the beginning of the hearing saying that this was just a first of what I hope to be many opportunities for us to convene like this. And I want to say a little bit about, some things that I've heard here, some themes that we've heard, an increased need for investment. I hear that. We know that. We see it. Opportunity to build sustainable funding streams. And where might we find those? How can we reinforce the sector? Looking at how can we pick up more efficiencies? What can we do as funders? And how can I use my voice as chair of this committee to reach out to other partners and funding partners to help see if there's a way that we can establish sort of a regional model, something that we have broad buy-in, so we're not just increasing efficiencies through the city and the city alone, but we're also trying to do that across the spectrum here at the local level, and workforce pipeline. I think if there's no one there to answer the phone, then it's kind of a moot point, right? And so to that end, I think it is my goal and intention to continue working with the Human Service Chamber to take a very deep look at not necessarily a frac, who was it, Mr. Childers, you mentioned this, but to take a very deep look at our sector and the subsectors itself, to better understand where are our gaps currently as they exist with funding for the various subsectors, and then how much have the needs in our community grown up until this point. And what's our projected growth? And what could we imagine the need for investment being? So we're not just looking at what needs exist today, but how can we plan strategically the same way we're doing with transit, the same way we're doing with housing? How can we plan strategically to be able to meet the needs of our community as it continues to grow? And so it is our hope that through that process, each of you who represents an organization or a stakeholder of any type, Department of Development certainly, that we can all continue to come together to participate in that process so that we can have a good number if we make it to a frac situation where we can walk in armed with the information we need to be able to share and say, this is what we need to support our community the way that they need to be supported. I also think we understand that looking at next year with ARPA dollars running out, there are going to be some funding challenges while we're trying to figure out those longer term solutions, right? But even 2025 budgets, there's certainly some uncertainty for with all of you, and we hear that. And so I think Councilmember Bankston and I are committed to exploring what we might be able to do to be able to infuse some resources into the sector right now to maybe help our organizations weather that storm. So we will be continuing to communicate with all of you about that. And I think, we called this hearing the state of the human services sector, I guess, which the name kind of makes me think of like the state of the city or like the state of the union, right? And so I think walking away from this, one thing that is very clear to me is that, the state of our human service sector is resilient. And we are strong, our organizations are strong and long-suffering, but we need to do more to continue to strengthen. And so that is my commitment to you, that we will continue with the utmost sense of urgency to work collaboratively with you, with our city departments, with the chamber to explore those solutions and be responsive to the very real needs that we heard today. And so thank you again for being here so sincerely from the bottom of my heart. And we look forward to continuing the conversation as we move forward. Thank you.